Hello friends, I am Dr. Chintan Gujrathi. I am a consultant plastic, cosmetic and reconstructive surgeon at Symbiosis University Hospital and Research Center. Today I will be discussing about a very important topic, which is hand injuries, the various modes of presentation, their management and the various protocols. So upper limb and hand injuries are one of those injuries which lead to many days lost from work annually than any other occupational injury. So these hand injuries, like any other facial injury, are easily seen by any observer. But as a physician or as a doctor or as a plastic surgeon, it is important to address the other more life-threatening or critical injuries which the patient has sustained. So accordingly, just like the facial injuries, these hand injuries, when it comes to the patient and surgeon. So as a patient, what the patient is interested in is whether he'll be able to do his routine day-to-day activities and whether they will be done by expert or whether it will be done by competent people. So basically a patient needs information and assurance. So when it comes to a doctor or as a surgeon or as a plastic surgeon, what is important to understand is what depth of the injury or what are the structures that have been injured and whether the patient will be able to regain his complete range of motion or not after the surgery or whatever procedure we have to do. So these injuries can be categorized as maybe major injuries and minor injuries. So major injuries are maybe those which require some kind of a surgical intervention, some kind of an anesthesia. These usually are more severe injuries associated with more contamination, whereas minor injuries are those which are more subtle. Also, you can say these can be open injuries or closed injuries. So closed injuries usually I would say are more dangerous because they are usually not manifest and missed by many. So accordingly, another way that you can look at it is maybe a slicing injury or a cutting injury. So these injuries are like more of a sharp cut injury where there is no loss of the skin and there is injury to the underlying tendons and the underlying structures. And other form would be a crushing injury where there is more loss of a skin and what needs to be assessed is the viability or whether there is good blood supply to the skin and the deeper structures. So it can be either a cutting slicing injury or a crushing kind of injury. Now these can be one of a very mildest form like some bleeding underneath the nail or very severe form like major power press injuries. But usually these are kind of mixed injuries. So these need some kind of a certain level of expertise, I would say. So better done by a plastic surgeon having good microsurgical skills. Also, even the simplest or the minor form of injuries like a nail or a nail bed injury, it is essential that the integrity and the smoothness of the nail bed, that is the structure on which the nail sits, is restored to ensure that the nail which is coming fresh would be smooth and without any distortion. So another consideration here is the time frame or the time that has elapsed from the time of injury to the time when the patient presents to the hospital. So certain injuries require certain expedition or they have to be done on a very emergent basis. Say for example when there is bleeding from any major blood vessel or the arteries of the hand or the forearm, when there is some kind of a compartment syndrome wherein the pressure within the forearm and the hand rapidly increases and we need to relieve that pressure immediately. Also other injuries like the amputation injury wherein the part, any finger or the hand or any part of the forearm is chopped off from the rest of the body. So the reattachment of this completely or incompletely severed part to the body has to be done within a certain time frame. Also it is important to understand, I would tell at this point, how that part has to be brought to the hospital from the time or the place of this incident. So this amputated part must be wrapped ideally in a saline moist gauze, kept in a dry watertight plastic bag and then kept in turn on any ice pack. So this is the ideal way by which this part has to be brought to the hospital. And it is important that these surgeries be done in an ideal setup where many times we require operative surgical microscope to join all the small blood vessels and the nerves back to the body with the help of a microscope. So it has to be done in a proper setup. Another thing here I would say is it is not just the surgery, but it is the post-operative protocols also. So whenever there is injury to these tendons or all these structures of the hand and the forearm, ideally these should be done within a time frame of say 2 to 3 days before there is a lot of adhesions or there is a lot of tension in the repair that we do. So within 3 days is the ideal time frame by which it should be done. Also, the repair has to be strong enough to ensure that the patient does physiotherapy after surgery, and we can start the physiotherapy early after surgery to prevent these adhesions. So not just the surgery, but the post-operative protocol or the post-operative things that we do, first of which includes a lot of dressings. So certain dressings are done to ensure that the hand remains in a proper position of function, or that the hand should be in a good range of motion after surgery. So in general, you can say the position of the hand is one like when we hold the glass. So this is the ideal position in which the hand should be kept. Also, the hand should be elevated to minimize the edema or swelling that comes after surgery, because any edema fluid or any swelling is a good raw material for hand to be stiff. So stiffness and swelling is one to be avoided. So before I end, I would like to tell that these hand surgeries have to be done very systematically and in a very efficient manner. So at SUHRC, we have all the infrastructure to deal with all these injuries on a very emergent basis and at a very affordable price, a price that even the common man can afford. So I would like to advise all the patients, all the people who sustain such hand injuries to come at SUHRC and get operated. Thank you.